So when your sciatica symptoms are coming from degeneration of the spine, a spine that doesn't move well, some arthritic joints, I want to show you this technique. And generally, in those cases, most patients respond well to what we call flexion, so the bending of the spine. And I think a better way to address this versus standing, because that puts a little bit more stress on your back if you're standing up with your legs straight. If you get on your hands and knees, you might be able to stretch a little bit with a little bit more ease. And then I'm going to show you this one, and then I will show you as well as doing this in a chair, which might be fairly convenient for a lot of people that spend a lot of time in sitting. So the first one, on your hands and knees, what I would do with your hands right underneath your shoulders and knees right underneath your hips, just round your back, and that bends your spine. And then what you're going to do, you're just going to rock back to the ideal stretch is going all the way down and sitting on your ankles. You might not be able to do this at first. It might take you several days to really loosen up this, especially if it's acute. So at first I would just start like this, round your back slowly, and depending on what is involved and what level, what joint it might be stuck, that's when seeing a manual physical therapist would be really beneficial, because you might need a little bit of help with unlocking that joint, and a manual therapist can do that. So again, we can go all the way down, do this several times, and then finally when you tolerate this position better, what I would do is hold this for up to 30 seconds and just really relaxing, letting your back stretch. What you might have to do, as same thing as when we were standing, is you might have to tweak things a little bit around. You might have to turn one or two legs in and out to tolerate the stretch better. Actually, you might be able to go a little bit further if you do. So this is with both feet going out, or your hips going in, and then the opposite with your hips going out and the feet going in. And very often you tolerate. This helps if you do it on one side. So if the technique with both legs straight does not work, I would just add. I would start with one side, the side that hurts, and then go like this, and then see if that relieves some of your symptoms. So the other technique that I would like to show you when you suffer from back pain and sciatica and respond well to flexion, so I just showed you how to do this on your hands and knees. You can also do something similar in a chair, sitting in a chair. And basically it's just going to be sitting down and bending forward progressively to the point where you tolerate this a little bit better. And what this does, it opens your spine, putting a little less pressure on all those injured or irritated nerve roots and joint capsules. So you can work your way down and holding this for up to 30 seconds to several minutes, depending on your taste and how much time you have. This works really good for people that have stenosis as well. So same thing with arthritic changes in your spine. You're going to have a narrowing of the foramen, where the nerve roots are coming through, and that tends to irritate them. So people that start having sciatica type pain from standing for long periods of time, or as well as with walking, they tend to respond well. So my recommendation would be to just sit down wherever you can and then just do a few repetitions of these, and generally people can get some relief fairly fast when they do that. So these are very generic again. There is many other things that can be contributing to your pain, so you might need a professional opinion and a full assessment to determine the best course of treatment for you. So I hope you enjoyed, and good luck to you in your back pain.